Hello, this is Doug Johnston with AARP. You are on a live TeleTown Hall forum. We already have over 500 AARP member listeners on this live TeleTown Hall forum, also being streamed on the internet. It's a pleasure to have all of you join us for this discussion with two very important people in state government. To my right, for those of you on live stream, this is Mary O'Dowd. She is the Commissioner of the State Department of Health and Senior Services, which is a huge department, covers a wide variety of topics, issues, and programs. And our other guest on the program today is the State Commissioner of the Department of Human Services, which I do believe is the largest department of state government. I want to welcome the AARP members who've chosen to join us on this live TeleTown Hall forum.
We know that our seniors, and AARP doesn't stop reminding us how our seniors want to age in their home and a community setting for as long as they can. And our job is to invest in those home and community-based services, whether it's services like Meals on Wheels for individuals who need just a little help with making sure that they're eating a nutritious meal, or those programs such as home health aides or others that help someone who has a little bit of a challenge or a medical condition. They need a little bit of health care before they get worse and need the services of a nursing home. So our goal is to continue to invest in those programs that help our seniors stay in their home and community, and we continue to see that in this budget.
Part of the impetus for some of the change that we're discussing today is, in fact, what I've mentioned, which is Medicaid, and we've been trying to figure out very actively how to both increase the quality and availability and access for the appropriate services so that people can stay in their home with more options, and also rein in some costs so that we can invest in services that people need, as opposed to just move into a nursing home as one of their only options. We want to keep people in their home for as long as possible, as long as they're able to.
LJP asked, what can you tell us about how the move to managed care or Medicaid will affect long-term care services?
What we envision in terms of the move towards managed care is to further some of our success in investing in home and community-based services. Well, back in 2007, only $30 million was invested in our home and community-based services, or our signature program, the Global Options Program. And now in this budget, we have over $280 million invested in that same program. So if you think about that short period of time and the investments that we have made, in particular with Governor Christie's leadership, to focus on our investments for home and community-based services, and that's just one of our signature programs. We have other programs that aren't even in that, like Meals on Wheels, that we know are really important. So when we talk about the movement to managed care, we think that that will even further those efforts.
It took me 2 months to find a new primary care physician, and I ended up finding her on my own. The people who tried to help me find that PCP tried their very best by giving me many doctors' names. They really did try hard, but they just ran out of doctors. Some doctors said they were specialists and not considered PCPs. Some were 50 to 90 miles away, but the majority of every doctor they gave me told me they were not taking any new patients.
We have the ability, to enforce penalties and fines on a company who make representations about access and adequacy of network that in fact turn out to not be the case. We should do this with you today, is to find out who it was, who the company was, so that we can ensure that you had a primary care within a reasonable radius to you.
New Jersey is really pushing the envelope of transparency and reporting healthcare quality measures in this country, and that's a testament to your good leadership and previous administrations and AARP's work on this issue. I just wanted our listeners to know that, because nobody uses healthcare services more than AARP members and people who are in their older years. It's obviously a very critical issue.
The only thing I have found that I could hopefully rely on was PAD. As you can imagine, I think it was 2 years ago now, it was just impossible when they said they were going to take it back. They weren't going to have it anymore. Without PAD, I don't know what I would do. Most probably it would be a decision between eating or prescription drugs.
Susan, thank you so much for your call, because I think your story is a very real story for many of New Jersey's residents that rely so much on our PAD and Senior Gold program. In just the last year, we enhanced the program. So those seniors that are part of the program, we reduced the copay for those people who are using generic medications. So in the last 2 years under Governor Christie's most recent budgets, he has enhanced the program both by making the current benefits more affordable as well as increasing the eligibility limits. And as a result of taking that pharmaceutical assistance program data and matching it with our the information for the food assistance program, we were able to enroll an additional 30,000 seniors in New Jersey into this food assistance program. And that was really just an example of government working smarter to meet the needs of our communities.
92% of AARP members, when we survey them, 92% say they want to stay in their homes, in their communities, close to their families as long as possible, rather than having to go into a nursing home. Nursing homes are a critical part of our healthcare structure, but most people want those services that can help them, again, with their activities of daily living, to stay in their homes. Could you tell Robert from Whiting about what your departments can do for people in that type of situation?
Absolutely. This harkens back to the comments I made earlier about our desire and need to invest more into our home and community-based services. And we have a number of programs that are in our senior services program that provide for those people who are eligible for Medicaid services and those people who are just above Medicaid and still have enough resources that they don't yet qualify. And the different types of programs that we offer include things like home health aides, or include if you need a ramp put into your home so that you can now access it as from a wheelchair because something occurred in your life and you no longer can take those stairs. And so we help with all different types of things, either adjusting your home environment so that you can live there and age in place for a longer period of time, or with medical care and options.
I do think that having both organizations and individuals involved in any part of change really ensures the best process. So I think I will echo that we're all in this together. So it really is a personal issue to be sure that we've got access to quality services really at our fingertips so we can have the best options available to us. And choices. We all want choices in how we age. And aging in place, I think, is probably one of the best things that was mentioned today. Thank you.
Thank you so much for the opportunity to be here today. I hope we were of some help to some of your listeners, and hope that they will access services that they found out about today that they're eligible for, and also help some of the members of their community, their neighbors and friends that may also need just a little bit of a helping hand, and know that we're all in it together. So thanks again for having me, and thanks to AARP, because Doug mentioned it earlier, but specifically on some issues around quality and making sure that we're doing our best job here in the state of New Jersey. AARP has very much been at our side, working to identify those areas where we have opportunity to improve, and I really thank them for that advocacy.